big part of being a good injector is knowing how to, first of all, identify, and number two, treat and deal with a vascular occlusion, because people have gone blind in one eye because of a filler procedure, typically like in the nose, or filler got inside of the blood vessel and traveled up to the brain and caused a stroke. I mean,
Welcome to the Beauty Talk podcast, where we feature how the best medical practitioners help their patients to look better, younger, and healthier. Now, enjoy the show, and here's your host.
Daniel Gao here. I'm the host of Beauty Talk, where we feature the top medical practitioners in health and beauty, both inside and out. I have Chad Van Horn of Icon Aesthetic and Wellness. He's a board-certified physician assistant and the owner and founder of Icon Aesthetics and Wellness in Pompano Beach, Florida, just north of Fort Lauderdale. He is a master injector and hormone therapy specialist with over 8 years experience in the field. He's an injector trainer for several companies, speaker, husband, father of 2 girls, music producer and DJ, and an amateur Instagram comedian on his page at needle_daddy. So Chad, welcome and glad to have you here.
thank you for having me.
So let's dive right into it. How did you first get interested in aesthetics?
So my journey here was fraught with twists and turns. I went back to PA school following the housing crash of '07, '08. At the time, I was working in construction sales and flooring, and so I decided to kind of take a step back and take 2 steps forward and look for something that was a little bit more recession-proof. And so my original intention was to go back to school to be a physical therapist, and then throughout that journey got swayed into the PA route and thought I was going to end up in orthopedics. And then by the end of my PA program, I was like, you know what I really like doing is hands-on procedures, but also having a really cushy schedule. So where can I do both of those things? And it just so happened that I found this job posting through no connection whatsoever. It was just like a random job listing like Indeed.com, and I phoned them up, and they turned out to be like an IV clinic that was pretty new, like 2 years in business, and that was all they were doing at the time. And they were looking to expand their service offerings. I met with the owner and founder, who was an EMT firefighter himself by trade. And he basically kind of gave me the vision for what they were trying to do. He's like, we do IV therapy, we do B12 shots. We want to bring on Botox and fillers, medically assisted weight loss. We want you to, interpret this very comprehensive lab panel, assess for vitamin deficiencies, hormone imbalances, and use the lab results to, basically create a plan, like a diagnostic selling tool, basically to recommend, certain types of IVs and things that would be appropriate for them, testosterone therapy, weight loss programs, that type of thing. And I was like, I don't know how to do any of that stuff because that's not what they taught us in school. But, coming from a sales background, I did feel comfortable talking with people. And I also felt comfortable talking numbers with them because it's 100% cash-based medical type of services. And so it was very much a departure from what I thought I was going to end up doing. And so for a while, my job was half doing the interpretation of the labs and doing the aesthetic treatments like the Botox and fillers and what have you. And I am a natural creative type. I come from a very musical family, hence the music production, the DJ stuff. I also play guitar and piano. It was always a part of my life. And so it was kind of like the marriage of the art form and the medicine when it came to my approach to somebody's face. And I kind of just took to it like a fish in water. It just kind of came very intuitive and very natural to me. And I was largely unsupervised when I first started. They had a medical director, but that man never once set foot in the building the entire 3+ years that I was there. So that's kind of how I started in the industry. But I came up in that sort of functional and integrative model. And hence I still do both of those sides to my practice today, when it comes to, and that's why it's Icon Aesthetics and Wellness. So that's how we ended up here. And I did not intend to be here, but it was kind of like circumstantial, and it's just proven to be a really great fit for me.
Got it. So how did you make that transition over to starting up your own practice then, since you were in industry? How did you make that transition? Or I guess what prompted you to want to set up your own practice?
So it was a few things. I mean, the first place that I was at, I was there for close to 4 years, and a few of those years were really, really great. And then, they decided to make some business decisions that started to become not so much in line with the way that I wanted to run, my practice personally. And because I had essentially started from scratch and built a business inside of their business, I mean, when I tell you I had an empty room and I had to create everything from scratch. I mean, I went shopping at IKEA for the furniture and the desk, and I had to set up the accounts with different compounding pharmacies and aesthetic companies, so that we could start ordering product through them. So because I learned that entire back end side of the business, I had kind of been like, thrown off into the deep end. And so I just used that knowledge to basically get to the point where I was like, you know what, I think I could hack this on my own. And so, there came a point in time when we just parted ways, and I wanted to focus more on a quality over quantity type of model, whereas they were very much like a Groupon driven, high volume type of business model, and it got to the point where it wasn't really jiving with me anymore.
Got it. Now, I want to dive a little bit deeper into the treatments that you provide. What could you share maybe one or two of the most common and popular treatments that people come to you for? And also, why do you think that they're so popular?
Sure. So I would say for me, I would say about 75% of my business is the aesthetic treatments, which would be largely, Botox, botulinum toxin treatments. That's usually everybody's gateway drug into the other stuff like dermal fillers and lasers and things like that. Not always, but a lot of the time. So I do a lot of Botox treatments, and people think that you can kind of go anywhere for Botox, and like Botox is the easier thing to do, but like dermal filler is the thing that you really need to, be picky and choosy about. But it's actually kind of the opposite. Like in the industry, we say Botox is the easiest to learn, but it's the hardest to master because if you mess it up, there's no reversal agent for Botox. Like you're kind of just stuck with that result. If you drop somebody's eyebrow or eyelid, I mean, there's corrective moves that we can do, but when it comes to dermal filler, like hyaluronic fillers, like Juvederm, Restylane, and et cetera, we can reverse those. We can dissolve them down if we have a result that we're not happy with. So I do a lot of Botox treatments. I'm really, really good at it. I was essentially self-taught, and so I use that kind of muscle physiology training that I had when I was originally going to be a physical therapist to kind of intuitively guide me. And I created a system, and I've tweaked that system over 8 years, and my results are now pretty consistent and pretty well done most of the time.
Mhm.
I also do pretty good lip injections, and so I do have a lot of girls who come and see me specifically for lips.
Mhm.
I also excelled on Instagram. I had a lot of people coming in on Instagram because I knew how to not just do good lips, but also like present them really, really well, which is a big, big part of it, right?
Yeah.
So just knowing lighting, knowing angles, and how to present your results in a way that's most favorable was really meaningful, because I can't tell you how many injectors don't know how to use lighting to their advantage, and so their before and after pictures just they don't look good or what have you. And so I kind of had that competitive advantage, I guess, when it came to my results. Fast forward to 2025, I now do laser treatments like CO2 resurfacing and stuff like that, which I love because not you can't solve every problem with Botox and fillers,
Mhm.
unfortunately. So the skin is changing over time. It's losing collagen. It's creating fine lines and wrinkles, and we can't put Botox all over the face. There's only certain spots that we put Botox in, and so I do like doing my laser treatments because it makes the skin just look radiant and glowing.
Mhm. Now, I want to talk a little bit more about regenerative medicine because I'm starting to see more and more regenerative medicine treatments coming into the aesthetic space. Could you share your thoughts on regenerative medicine? Number one, what is it? And then how do you feel that it really ties into aesthetics?
Sure. So it's kind of a two-part answer. Regenerative medicine is just the idea that instead of just continuing to stuff a face full of filler, which is, I think, what's gotten HA fillers a bad rap over the last couple of years and sensational, reporting on Instagram and TikTok and what have you. Dermal fillers are kind of, I guess, in some circles falling out of favor. And so regenerative medicine is the idea that we're going to use treatments to try to keep the skin as young and youthful for as long as we can. And then how do we regenerate that skin and cause it to behave and act more youthful? How do we maintain collagen for as long as we possibly can, right? Because that's collagen is the thing that we're all after, collagen drinks and collagen supplements and this and that and the other. And so we've got external treatments like biostimulators, which would include things like Sculptra, Radiesse. And these are kind of like fillers, but they sort of fall into this subcategory called biostimulators. And then you've got everything like skin boosters out there, exosomes, which are kind of like stem cells, but not really. Exosomes come from stem cells, but they help with the actual work. So the way that I explain it to clients is when you use exosomes, it's kind of like that show Extreme Home Makeover, you
Hmm.
know, where
Yeah.
they, instead of in a normal reno project, you might have a crew of guys that's maybe like 4 or 5. But if you show up with a crew of like 100, 200 people, the work is just going to get done at a much, much faster pace. And so that's what things like exosomes, growth factors, the salmon DNA and everything
Mhm.
like that's come out. That's essentially what they're meant to do is just basically accelerate healing after a treatment like laser or microneedling, and then also just cause the skin to regenerate and behave more youthfully. And then the other half of that is what happens internally, and that becomes more pertinent, around age 40s to 50s and beyond, and especially after women go through menopause and their hormones change. And so when I describe hormones, I describe them as the internet speed of the body. If you don't have hormones, you just have really slow dial-up internet, which, nobody under the age of 30 is going to remember what that was. But
Mhm.
I'm an 81 baby, so I was in high school when AOL and AOL AIM Messenger came online, and
We'll
and
try
so
not to date ourselves too much with that knowledge.
I know. So I know what dial-up internet is, but that's essentially what happens to the body when women go through menopause. Some men also experience like a drop in their testosterone levels. And believe it or not, those hormones are critically important in maintaining the cell-to-cell communication, the organ-to-organ communication, and also just helping keep the body in what we call the anabolic state. Everybody's probably heard the term anabolic steroids.
Mm.
Well, the term anabolic just refers to how fast does your body burn calories to build new things like cells and muscle and bone, etc. Whereas the opposite would be the catabolic state, this the state of breakdown and decline, where you're losing cells at a faster rate than you're replacing them. You follow me?
Yeah.
And so that's where things like hormone replacement therapy, testosterone therapy, peptides comes into play, as well as just, counseling clients on doing all the things that they can be doing, like the diet and the exercise and all the stuff that doesn't really cost you any money, it just costs you your time and your discipline. But it's obviously like critically important because lifestyle matters.
Yeah. Now, with this trend of anti-aging, more natural look, do you think that this is something that is here to stay, or do you think it's more just like a passing fad?
No, I think I mean, we're always going to be aging, right? And I think we're only going to get better from here as new technologies emerge, as they develop, as they figure out all the different stuff that you can do with, stem cells and exosomes and things like that. I mean, there's companies out there that have these investigational studies and permission from the FDA to, do things like stem cell injections and exosome injections. I just got back from an advisory board meeting with a cool company that's based out of Mayo Clinic in Minnesota. And obviously, Mayo Clinic is very heavy into research, and they're doing some very, very cool things over there that, unfortunately are not even really like FDA approved per se, but everything on the medical side to the cosmetic side in terms of how can we just cause the cells to behave as youthful as we can for as
Mhm.
long as we can. So I don't think that regenerative medicine is going anywhere anytime soon, and so far we haven't figured out how to stop the aging process. Best we can do is kind of help to slow it down a little
Mhm.
bit, but nobody's we're always going to be chasing the fountain of youth, whatever that looks like. And so all we can do is use the tools that are available at the time that we're using them, right?
Yeah. Okay. Now, Chad, I want to dive a little bit deeper into your practice specifically. I mean, you have the experience, you have the knowledge, but how else would you say that you differentiate your practice from others in the industry?
Like I mentioned earlier, when I started out on my own, I wanted the focus to be on quality over quantity. So I'm not a high volume practice, and that allows me to spend more quality time with each individual client that I'm dealing with, and allows me time to sit down and really kind of, first of all, hear them out, right? Because the first step in being a good healthcare provider is listening to your client, your patient, and what are their concerns, because there's all kinds of things that I could do. And I think a lot of places, a lot of plastic surgeons, injectors, they they tend to push their personal beauty ideals on them.
Mhm.
Whereas I would rather just meet them where they're at, first of all, because obviously, like, not everybody's goals are going to be the same, right? You've got clients, I mean, let's just take the aesthetic treatments. You've got clients who want to look like they did nothing at all, and they're kind of still afraid of the stigma of that. And then you've got clients on the opposite end of the spectrum. They're just like, make me as hot as you possibly can. I don't care if I look like I have it. This is the look that I want. I want to be a Barbie doll. Make me look like a Barbie doll. So first and foremost, I try to figure out and understand my client and where they're coming from, and then I create kind of a custom tailored plan that's going to help them, achieve what they want to achieve with the tools that I have available. And sometimes you got to just level with people and be realistic and say, I I don't have the tools to create the result that I think you're looking for. And so I'll refer out when it's appropriate to do that, whether it's a technology that I just don't have in my office, or maybe they need surgery, they need plastic surgery, they need a facelift. And people don't like to hear facelift, but nowadays plastic surgery and facelifts are evolving just like all the other treatments are. And so they have minimally invasive treatments, minimally invasive facelifts. You can do, the lunchtime lifts, the lower lifts. It's not what it was 20, 30, 40 years ago, where people looked like they were just peeled back and super weird and plastic looking. So I try to at least lay out all their options and meet their needs. So it allows me to not really have to be like a pushy salesman, and more just like, let me figure out what you're trying to do, and then I can give you what I think is my best opinion on what's going to help get you those results.
Yeah, and I think that's a really important point that you brought up as far as educating your patient, setting the right expectations. 'Cause, I mean, you can be the best in the world, but you're still going to have unhappy clients from time to time, no matter how good you are.
Yeah.
So, I mean, is that something that you just kind of learned over time with your experience, like how to set the right expectations, how to educate your patients, or I guess, how did you come to this philosophy of how you approach it now with educating them?
I mean, I've always been of the belief that I would want somebody to be honest with me if I'm on the other end of the needle, right? Because nobody likes to have their expectations not met. So at the very least, I would rather under promise and over deliver. And a lot of that just comes from experience and understanding, like, what your tools can do for you. Like, what kind of results can you expect if I put like two or three syringes of dermal filler in certain places? Like, what does that actually translate to as far as like a look and a before and an after result? Do you know what I mean?
Yeah. Okay. Now, I'm sure that throughout your experience, you've had some patients and clients coming in. I'm sure they have a lot of misconceptions about the treatment you provide. And you kind of mentioned that before with the dermal fillers versus the Botox and all that. But what would you say are some other common misconceptions that you hear quite often about the treatments that you provide?
I would say, especially for like new and first time clients, lips, I would say most commonly, I'll have girls come in and they assume that every other girl that comes to see me is the one that wants to look super blown up and weird, and they're like the 1 out of 10 that wants to look natural and normal. And it's actually the opposite. I would say 9 out of 10 clients come to see me and they're like, I don't want to do anything crazy. I don't want to look like a blow up doll. I don't want to look like Kylie Jenner, circa 2020 or something like that. And, I have to tell them, you're kind of like in the majority. Like, most people, most girls actually feel the way that you feel. And it's like that one outlier is the one that's like, take me to the moon.
Mhm. Okay. Now, what about GLP-1 weight loss? It's kind of blown up a lot over the last 2 years. There's a lot of people that swear by it, that, oh, it really helped people lose weight, and it does help people lose weight. But then there's on the other side of it where there's studies and doctors saying that, well, yes, you lose weight, but you also lose a lot of muscle mass, which is really bad for you. So I want to get your thoughts. Like, do you think that the GLP-1s are good for you or bad for you, or somewhere in between, depending on the situation?
It's obviously very situational. Um, just like anything, there's a right way and a wrong way, right? And if you put all the clients on a spectrum, you've got everybody from your 20-something-year-old girls who are just trying to look bikini ready for summer, and just want to drop like 5, 10 pounds, and they don't want to work in to get it. They just want to turn on the cheat code and make it happen. And then on the opposite end of the spectrum, you have your full-blown, type 2 diabetics out there who have maybe some comorbid medical issues, right? They might have metabolic syndrome. They might have like fatty liver disease because they've just gotten to the point of their metabolism has slowed down to the point where it's just there's accumulation of adipose tissue. They're overweight, they're obese, and these drugs are miraculous for those people. If you want to just like talk about like the long term and the medical side, the number one killer in America is heart disease, right?
Mhm,
A lot of people don't know the number one cause of heart disease is diabetes,
mhm,
right?
mhm,
Diabetes is when you have so much sugar circulating in your bloodstream that it literally starts to caramelize your red blood cells. And then your red blood cells can't flow through those tight passageways like the arterioles and the capillaries. And that's why type 2 diabetics tend to have very poor blood flow. And if you take that to its furthest extreme, they start becoming ischemic and necrotic, and that's when they have to start chopping off limbs, and it's a horrible situation, right?
mhm,
And so if you can take somebody out of a diabetic type state, right? Because type 2 diabetes is very much reversible most of the time, right? Type 1 diabetes is a different situation. That's an autoimmune attack on the pancreas. That person's going to be on insulin for the rest of their life. But type 2 diabetes is more of a metabolism issue, and you can actually reverse type 2 diabetes. And these GLP-1 medications are doing a way better job at doing that than any pre-existing drugs that came before, better than insulin, better than metformin. So I think they're awesome for that population, right? Because studies have shown they're reversing fatty liver disease, buildup of that internal fat around the organs, which is very dangerous. It's helping with heart disease. So it's actually extending like all-cause mortality and cardiovascular mortality. I mean, they're doing a better job than the actual cholesterol medications. So from that standpoint, I think they're pretty awesome. Now, if you were talking about just your average healthy individual who is just they don't have any medical issues and they're just trying to lose weight, then I think it's all a matter of how much and for how long, right?
mhm,
Because you can stay on it for long enough to the point where you become very like cachectic looking, and you're going to see that in the face. And that's where we get the term Ozempic face from, because as you lose weight, you do have fat pads in the face, and so you are going to lose weight from your face, and that's where your injector comes into play to help revolumize some of that fat. So there is something to be said for carrying, an extra couple pounds, because it's almost like having free filler in your face.
mhm,
It's going to look softer, it's going to look rounder, whereas a leaner person may look prematurely aged, like hollow, right? Like the places that we tend to hollow out most commonly is going to be like your temples, your under eye area, this area underneath your cheekbones, and then around your mouth.
okay.
And I know that because those are the places that I very commonly will put filler and biostimulators to kind of help revolumize that and soften that up. And for what it's worth, every single one of those areas I have had treated on myself, right? So I'm 43, turning 44 in September, and I'm just trying to stay hot and skinny for as long as possible, just like everyone else.
But you look like you're still in your 20s.
Thank you. I'll take it. This is preservatives added from here on out. There's nothing organic about this face.
Okay, well, now, Chad, you brought this up a little bit earlier as far as the artistic side that goes into this. And I want to ask you, what role do you believe creativity plays in how you approach your patient care? Because when people think about medicine, it's usually there's a textbook way of doing it, there's a protocol, there's a procedure, but within aesthetics, you need to have that artistic eye that you mentioned. So how important do you think that creativity plays a role in aesthetic medicine?
I think it's very important. I mean, unfortunately, the only requirements to do these procedures are having a medical license or maybe a nursing license. And having a medical license does not an artist make. you know?
Mhm.
And so that's what I think separates the good injectors from the great injectors is just understanding when it's time to fill and maybe when it's time to not, right? It's just like when you have a black belt in karate or whatever, half of that is just understanding when is the time to not use martial arts and
Mhm.
show restraint.
Yeah.
And it's very easy to have a client who comes in and they've been doing so much for so long that it almost the treatments start to become like a crutch for them, and they just feel like they need to do something on their face to make themselves feel better. And some injectors out there will kind of like let them have their way and just do it because they want to have it. And then other injectors will say, you know what, like I respect your that you want to do this, but I'm just telling you from my standpoint, I don't think this is going to make you look better. If anything, it might kind of make you take a step back and look less aesthetically pleasing. So, and you can't really teach that, right? Like
Mhm.
it's just like photography. Like you have good photographers and you have great photographers out there, and it's just kind of something that you either have it or you don't.
Mhm. Okay.
That actor.
Yeah. Okay. Now, Chad, I'm sure that throughout your experience, you've run across some particularly challenging situations. So, do you mind sharing a story of maybe one situation that you ran across that was just really tough and how you were able to work through that and get a successful outcome in the end?
Sure. So I have actually been the recipient of clients from time to time who came from what are thought to be like really great injectors. One particular story comes to mind when this is probably going like 5, 6 years back, where I had a client come in, young girl, beautiful girl, and she had gone in to see this injector who I believe was also a plastic surgeon, and he was very big on what we call facial balancing, right? Which is the idea that we're going to just inject a whole lot of filler and basically reshape your face to be its most aesthetically pleasing and proportionate way. And so she came to see me and she was just totally distraught because she had walked in expecting one thing, maybe just doing a little bit. I mean, she's 20 something, right? So she's got all the facial volume that she's ever going to have. And at that stage, it's just about augmentation. You're not revolumizing anything because she already
Mhm.
has everything she's gonna have. It's about augmenting, right? Like taking perfect lips and just making them a little bit bigger, or cheekbones, enhancing them, or something like that. Well, this guy basically hard sold her on several $1,000s worth of facial balancing. And, he did what he thought was going to give her the best aesthetic result. But she didn't like it because she felt like it had changed the shape of her face. She was just like, this is not my face anymore.
Mhm.
And so I had to essentially help her take steps backwards to get her back to what she felt like was more of a natural state. So we used dissolving enzymes to kind of just essentially undo, the work that she had been done. So I guess the moral of the story is you have to have a pretty good sense of who you are and what you're looking for when you go in, and understand that even though we're medical professionals, doctors, PAs, nurses, nurse practitioners, we're still, first of all, we're flawed humans. And second
Mhm.
of all, we are subjective, right? Because in the aesthetic industry, it's like the wild, wild west. There's guidelines and there's standards, but you cannot take a cookie cutter approach to approaching somebody, right? And so, as a consumer, as somebody who's maybe interested to do these treatments, you just have to have an understanding of like what it is that you're looking for, and don't let somebody who is going to be doing it hard sell you into something that you're not comfortable doing, because there's so many other options out there, and you can find somebody that is willing to hear you out, listen to you, meet you where you're at, so that you can get a result that you're going to be happy with and not, end up with a different face altogether, unless
Yeah.
that's what you're looking for.
Yeah.
And some people are looking for that, and that's fine. But again, it's about understanding the individuality of the client and what their preferences are.
Mhm. Okay. Now, Chad, where do you think the future of aesthetics is going? We kind of talked a little bit about regenerative medicine, about anti-aging, but do you think that there's more to that, or do you really feel like that's going to be a really big push of where aesthetics is going to go in the future?
I think the regenerative part is here to stay. And I think the more data, the more research is done behind those treatments, and the more that we understand the human body and what the agents of aging look like, how cellular senescence works, which is basically the idea that so the prevalent theory of aging right now is that as your cells divide and make new cells, you have your DNA strands, right? Remember the double helix from high school chemistry and biology class? Well, the ends of the helix are what are called the telomeres or the telomeres. And the prevalent theory of aging right now is that every time the cell divides, at least once you kind of hit mid to late 20s and we hit our kind of physical peak and prime, it's a slow decline from that point. And what happens is the telomeres at the end of the DNA strands are getting just a little bit shorter and shorter and shorter over time. And so we're losing, I guess, important information. And then what happens is you start creating these senescent cells, which are also called zombie cells, which are basically taking up space but not really doing any meaningful function or benefit to the body. And so another part of the anti-aging process is going to be how do we prevent and get rid of senescent zombie cells so that the workforce that we are working with is as optimal and high functioning as possible. And so I think that's going to be a big part of it. I don't think dermal fillers are going anywhere anytime soon because they can do things that other things can't do. And they're really just meant to sit there and take up space, right? So like, when it comes to all your regenerative stuff, I'm not putting those things like in the lips or directly under somebody's eyes, except for maybe like a PRF situation or something like that, or maybe some growth factors. But there's no substitute for just like a good quality hyaluronic acid filler in the lips, because hyaluronic filler is a viscous gel that's meant to basically act like fat, right? And it's the only product on the market that can still currently do that, unless you go for like a bona fide fat transfer, which is a little bit more high level, more invasive, more expensive, and it's still pretty rare that they're going to do that in somebody's lips. So I think that the products that we currently have are still going to be around, but who's to say what happens, 20, 30 years down the road.
Yeah. Okay, got it. Well, Chad, I have one last question for you, but before I ask it, I want to point people to your website at icon-wellness.com. Now, last question is, what do you think is the most important piece of advice you can give to someone who's thinking about getting some type of aesthetic procedure done, but isn't sure which provider to choose?
So first of all, check the credentials, make sure they are in fact licensed to do what they do, because there are all manner of unlicensed injectors out there. And if you don't know to ask the right questions, then you may get hoodwinked by somebody who's not licensed to do what they do, which can be quite dangerous. I mean, anybody can stick a syringe of anything in your face. The reason why these are considered medical procedures is because there are complications that can happen. And so that's where the experience and the education piece becomes monumentally important, is not knowing how to do the procedure, but knowing how to handle complications if they happen. Take dermal fillers, for example. If somebody doesn't know what to do, you can actually create a blood flow blockage situation, which is called vascular compromise, vascular occlusion. There's all kinds of scary photos on the internet that would, put the fear of God into somebody about what a vascular compromise or vascular occlusion to do. And so big part of being a good injector is knowing how to, first of all, identify, and number two, treat and deal with a vascular occlusion, because people have gone blind in one eye because of a filler procedure, typically like in the nose, or filler got inside of the blood vessel and traveled up to the brain and caused a stroke. I mean, these procedures are not a joke. And so that's why they have to be done by somebody with a medical license. So that's step number one, is just making sure that you go to somebody who is licensed and experienced, and they know how to deal with those situations. And then I would say number two, check the reviews, obviously, because what looks good on Instagram, I mean, there's the results, and then there's the customer service piece, right?
Mhm.
Excuse me. And I know several injectors on Instagram that have quite a few. They have amazing photos on Instagram, but they have quite a few one-star reviews if you actually, go to their business side, because maybe they were just dismissive when a client had a concern, or maybe things didn't go 100% perfectly, and then they went to go follow up with that person and they just kind of got blown off, or that maybe they're going to get double charged just to see the provider again, and they didn't know that there was going to be that additional cost. For me personally, I personally guarantee my work. I never double charge. If somebody is unhappy with the results, I just tell them, just come back and see me. I'm just going to take care of you, you
Mm.
know? And so just understanding the injector's philosophy and kind of getting a sense of their vibe and who they are as a person. And not every injector out there is going to be everybody's cup of tea, you know what I mean? And so it's not a problem to go maybe have consultations with two or three people, just like you're going to do for like a plastic surgery procedure or something like that. I always tell clients, go sit down with two or three plastic surgeons, because inevitably you're going to feel a better vibe with one versus the other. And I think that's also going to be true for injectors as well. So don't shop on price,
Mm.
because they're shopping price because they're either brand new or they are desperate for clients. And then the reason I'm like, why are they desperate for clients? Are they not doing good work out there? Educate yourself, read the reviews, don't shop on price, because you're
Mhm.
buying a result. You're not buying units out of a Botox vial. You're not buying a syringe. You're buying the hands of the injector, and also the client experience, because you can get it done in a very painful way and you can get it done in a very painless way. And that's going to differ from one clinic to another.
Very well said. Well, thank you, Chad, for sharing your expertise. Now, Chad, where can people contact you and your practice?
So, if you're local to South Florida and you're interested to come see me, you can book through my website, www.icon-wellness.com. You can connect with me on Instagram at Needle Daddy. And I also have handles for the business as well, which is at icon_wellness.
Perfect. Well, great. Well, thank you for being on the show, Chad, and sharing your message.
Thanks for having me.
Thanks for listening to the Beauty Talk podcast. Any questions, please contact the practice directly with the contact information provided during the show. We'll see you again next time. Bye for now.